So, hi everybody, good afternoon. My name is Maddie Haley, and I want to welcome you all to the webinar series for the Autism Intervention Research Network on Physical Health, the AARP network. Thank you all for joining us today. Because of the number of participants, your audio will be muted throughout the call, but you can submit questions at any point during the presentation in the chat box on your webinar console and also in the Q&A function. The entire webinar is being recorded and it will be available on the AIRP website, airpnetwork.ucla.edu, which I will also put in the chat right now. There will also be a short evaluation survey at the close of the webinar. We invite you to provide feedback on this webinar and also to provide suggestions for our future webinars. And in the interest of time, let's go ahead and get started. So we first want to acknowledge the Health Resources and Services Administration as the funding source for the AIRP network. And it is my honor to go ahead and introduce our speakers for today. We have Dr. Lindsay Shea, the Director of the Policy and Analytics Center at the AJ Drexel Autism Institute, and also our AIRP Health Systems and Services Research, also at the Policy and Analytics Center at the AJ Drexel Autism Institute. And we have Dr. Amy Blank-Wilson, an Associate Professor at the UNC School of Dr. Blank-Wilson and Dylan.
Thank you, Maddie. We appreciate it. And thank you all for being here today. I'm pleased to be joined by my colleagues, Amy and Dylan, and we look forward to telling you more about our work on autism and the criminal justice system. We've embarked on this work together through funding from the International Society for Autism Research, or INSAR, to produce a policy brief on this important topic. I've been fortunate to work with Dylan and to partner with the Amy system, and it's been a valuable lesson to seek to bring in researchers who may not be focusing on autism to learn from the work before us and determine how we can build upon it. With that, I'll hand the presentation over to Amy to get us started.
Thanks. And great. Dylan, you read my mind. Thank you. Dylan's going to operate the slides for us as we go through this. It should be fun. So thank you, everybody, for joining us today. And my job is to give somewhat of a background. I have experience working in the criminal justice system and working with people with serious mental illness, particularly those in the criminal justice system. And we're going to focus today on the health aspects. I think to understand the health challenges that are facing people involved in the criminal justice system generally, we have to start by thinking about the scope of involvement or the scope of contact that people have with the justice system each year. So over 23 million people will have some form of criminal justice system involvement each year, over 15 million of whom will be incarcerated in a jail or prison at some point during the year. Now, that's a tremendous scope of involvement. And then we have to think about the different ways in which justice system contact impacts health. One is the stress that comes along with justice system involvement can have a direct negative impact on people's health. Then justice system involvement can increase exposure to communicable diseases, particularly for those people who are incarcerated. And it can also lead to a worsening of existing health conditions. Then for the people who are incarcerated, we see a limiting of access to high quality health care in correctional settings. And even people who are arrested and not incarcerated, we will see likely an interruption in their access to healthcare, because we know healthcare access is very sensitive to even relatively small disruptions. Then finally, it's critical to note that people also come into contact with the criminal justice system as a victim. And we have a very well established body of research on the negative relationship that victimization has on people's physical health. And we know that has looked at this. And we also have a growing body of research that have high rates of trauma and victimization themselves. And so this is another important factor when we think about health. All right, I think we're ready to go to the next slide. Because the reality is, despite the large number of people who are involved, we really know the most about the health of people, or the health challenges and health risks of people who are incarcerated. And I'm going to just stop for a moment and do a little leveling and explain what I mean by incarcerated, because you're going to hear words like jail and prison. And I'm just going to explain the difference. So for those who are familiar, please bear with me. When we think about incarceration, there's really three types of incarceration that we talk about generally. Jails are local correctional facilities that incarcerate people awaiting trial, and those who are serving very short sentences. So you might often hear things like jails are largely, so 70% will be people who are pretrial, which means, I like to always note, they've not been convicted of a crime. And then there's over 3,000 jails in our nation. They're all locally administered. And we see between 10 to 12 million people admitted to jails across this country each year. And the average length of stay is really quite short. Research that I've done has shown it can be as short as 7 days, the average length of stay. Now that will vary across the country. On the other hand, we have two types of prisons. We have state prisons and federal prisons. All I'm going to tell you about federal prisons is they're run by the federal government, and they're pretty different than state prisons. And almost all of our research is on state prisons, and they are run by states, and those are for individuals who have been convicted of a crime and they've received a relatively long sentence. How long the sentence is varies by state, but generally it's about a year or longer of a sentence that somebody would be serving to go to a state prison. Now, in any given state, like North Carolina has 48 state prison facilities around the state. I think Oregon has 2 or 3. So the number of facilities in a state can vary, and where a person will serve their sentence has everything to do with the state prison and almost nothing to do with the individual's connection to their home community, if that makes sense. Okay, so we have jails and prisons. Generally speaking, jails, we see tremendous churn, which is the idea that if you have 10 to 12 million people coming through the jails each year and the average length of stay is 7 days, people are going to cycle through jails, and the same people can be incarcerated in a jail multiple times in 1 year. But from a healthcare standpoint, it's very difficult to get a grasp from a treatment perspective on the health of people in jails, because most people aren't staying long enough for the ongoing healthcare services in the jail to even be able to meet them or begin services. Prisons, on the other hand, are a place where there is some stability and people are staying for a period of time. And some studies have even shown a slight improvement in people's health while they're in prison, because if you're lucky and you're in a prison system that has high quality care and you're able to access it, people may actually receive treatment that improves their health briefly. What often happens in prisons is that people's health conditions are identified potentially for the first time, like maybe high blood pressure, for example, something that might be identified for the first time while someone comes into prison. Now, the studies on the impact of prisons' health, impact of prisons on the health of individuals is mixed. I want to be super clear. But it is a different process. Okay, so regardless of all of these details I've just given you, this dizzying number of details, the reality is that over 1/3 of men and over 50% of women who are incarcerated in jails or prisons will report at least one pre-existing chronic health condition prior to their incarceration. And then once they're incarcerated, we see high rates of hypertension, we see high rates of diabetes, we see high rates of asthma, and a number of other health conditions. Okay, so I have my little paper here, and it printed double-sided there. I was having a panic attack for a moment, everybody, but I found my continuing notes. So and then the other issue will be that there's varying healthcare available in prisons and jails in terms of access to medications and other issues that can exacerbate the new or existing conditions. Okay, I think we're staying here for another moment, because this portrait I have painted for you is it's grim. It is grim. There's a lot of health challenges for people involved with the justice system, particularly people who are incarcerated, and it gets worse when people are released from incarceration. Their health risks and their health challenges grow. And I think for people who work in the criminal justice system or work with people in the criminal justice system, we think of that point of reentry, particularly that the first 2 to 4 weeks after release from incarceration, is a very precarious time for people, and particularly related to their health. Research has documented mortality rates that are 13 times higher for people leaving prison than in the general population, with suicide and drug overdose being some of the most prevalent causes of death in the returning prisoners during that time period. We also know that people's health is exacerbated by their need during the reentry process to find stable sources of food to get their basic needs met, to find stable sources of food and clothing and housing. And then if they're able to obtain those, people typically search for employment and then access to healthcare. So there are a lot of complex needs that people need to deal with in less than ideal conditions, in resource constrained environments. And so we see the impact on people's health. We know that besides high mortality rates, we continue to see high morbidity rates of co-occurring physical health conditions. We see heavy utilization of hospitals in the first year after release from prison, and very low rates of outpatient service use, which tells us that that we could do better in helping people optimize the use of preventative care. Okay, I think that's a lot that I've said there. Well, okay. So then the other thing we have to acknowledge and begin to research is the impact that racism, particularly structural racism, has on the health of people with criminal justice system contact. There's an extensive and well-documented body of research that demonstrates the health disparities and health risks that people face, the racial and ethnic disparities that people face in terms of their health risks and outcomes. Then when we're looking at people who are incarcerated, we know that there's an overrepresentation of people of color in the criminal justice system, and it's also very well documented. I'm going to share a couple facts here with you to help understand the scope and the complexity of this. A report by the Sentencing Project from data on the National Prisoner Series found that African American individuals were incarcerated in state prisons at a rate that was 5 times higher than white people. And that this rate can vary by states. So in some states, the imprisonment rate was 10 times larger. There were 5 states where it was 10 times larger for African American individuals. And then the report also found that there were 12 states whose prison populations were composed of more than 50% of the prison population was African American individuals. So in addition, Latinx people were found to be incarcerated in state prisons at rates that were about 1.5 times higher than whites individuals generally, with the rates being as high as 4 times higher in some states. So again, definite disproportionate levels of involvement, and then significant variation across states in terms of how high that disproportionate involvement was. So in terms of health, this is a really important thing, and almost a very understudied aspect of the health of people with criminal justice system involvement. And there's a couple ways in which the disproportionate involvement of people of color in the criminal justice system can impact health that we need to understand better. The first is that the effects of criminal justice system involvement on health can disproportionately impact people of color because of their higher rates of involvement in the criminal justice system. And then it can also have what we think of as a differential effect, which is that the effect of the justice system involvement on the health could be stronger for people of color than white people. And all of these things could be true. And there could also, I'd like to point out, the other ways in which criminal justice system involvement is impacting the health of people of color that we've yet to identify. Because the reality is that there's very little research on this topic. And it's a great challenge to do research on this topic in a system, for example, in the criminal justice system, which at this point is struggling to consistently report people's racial and ethnic identities in a way that can be researched. In many studies, we find we don't even have reporting on the racial and ethnic breakdowns of the people who are in the study. So there's a lot, I like to say there's a lot of room for improvement in research in this area, and there's much to be known because this is a really important line of research in terms of health for justice system involvement. People who are justice system involved. Okay, so now I get to give an overview of the sequential intercept model. I'd like to say I don't name drop often, but I like to say I am lucky enough to know Mark Munitz, who is one of the people who developed the sequential intercept model. He and Patty Griffin, with the help of Hank Stedman, developed this model. This was a bit ago now. That was published in 2006, but it's been around since the 1990s. And what they were really trying to do was to develop a framework that identified what they thought of as reliable and consistent points of contact with the criminal justice system. So this was developed in the context of the 1990s when we were becoming very aware of the overrepresentation of people with serious mental illness in the criminal justice system. And we were looking for ways to develop interventions to divert people with serious mental illness away from justice system involvement. And so the sequential intercept model is a framework that identifies reliable points of contact, meaning points of contact where community services, was how this model was devised, could come in and identify and work with people with serious mental illness who are in the justice system and provide services designed to help limit or ideally divert away further involvement. So in one way, it's a framework. And then this other really cool thing happened with the sequential intercept model. So you can see there's technically 6 intercepts because we have the 0 intercept, the community service intercept. And it does identify, it breaks it out in terms of law enforcement, and then a very focus on court hearings, initial detention, and court hearings. Again, if you're thinking in terms of diversionary services, that makes sense that you would focus on courts, and then jails and courts, that being the specialty courts, meaning like a drug court or courts for people with serious mental illness. And then we see Intercept 4 is reentry. It's stratified for prison versus jail, because I've talked about how those would be very different reentry processes and would require different services. And then the 5th intercept is community corrections, which is a period of time where people are in the community under the supervision of the criminal justice system. So, and you're going to get to see this again, and then the revised model. But that's the model in its original format. And and we can leave it here. Just one more thing to say about the sequential intercept model is that it started to be used as a strategic planning tool as well. Some people may have heard of SIM. It's now referred to as SIM workshops or mapping workshops. And this was the policy associates who really took the lead on taking this and making it a tool where there's these 2-day workshops that trained facilitators work with communities to go through, and they map out the resources they currently have, and it's always tied to a particular population. So when I've done this, when I've been a trainer for this, we've worked around people with serious mental illness and what the services are in the community for them. You can identify the services you have, the gaps in your services, and then it works with helping the community develop a plan for how to address the gaps. So now we can go to the next slide. And it's really the SIM model and the sequential intercept model is flexible, it turns out, in that the points of contact do not change based on, for the most part, based on who, who or what population of people might be going through the criminal justice system. And so the SIM model, and particularly the mapping workshops, have been used now in a growing number of areas. I've seen it used pretty significantly in juvenile justice work, and then to address the opioid epidemic are two of the areas where it seems to be taking on a life of its own. But again, the model stays mostly the same in the process, but the population of focus is different. And I will stop there.
Thank you so much, Amy. It's a pleasure to speak and to be here with you all. I'm going to transition us a little bit to focusing on autism specifically within the justice system. And so autism research has had a limited focus on the impacts of the criminal justice system, and specifically the role that the justice system contact has on physical and mental health outcomes. That being said, there are reasons to believe that autistic individuals may be especially prone to poorer health outcomes. For instance, research has identified that autistic individuals experience the justice system as high rates, both as victims and offenders, which each have consequential impacts on physical and mental health outcomes. As Amy alluded to earlier, individuals who are victimized are more susceptible to physical and mental health complications throughout the lifespan, in part because of associated traumas and stress. As well as the same can be said for other justice-involved individuals who have higher rates of co-occurring chronic health conditions, as well as higher mortality rates. Entry into the justice system can also complicate access to crucial lifelong services that support positive and physical and mental health outcomes. Autistic individuals already experience low rates of employment that limit access to employee-sponsored healthcare. And then compounding, a disability status with an offender label can further exacerbate the existing disparate employment outcomes and insurance access. This can then necessitate a heavy reliance on medical assistance, programs such as Medicaid, which are really an instrumental provider of home and community-based services. However, this health coverage can be suspended or even terminated through justice system involvement, again, further risking negative physical and mental health outcomes. A rate limiting step, and again, as Amy alluded to, in improving these and reducing justice system contact for autistic individuals is that autism research has too often centered the voices of white individuals at the expense of Black, Indigenous, and other people of color. And when thinking about the justice system specifically, this has significant consequences because the justice system is so rooted in systemic and structural racism that sees Black, Indigenous, and other people of color experiencing increased justice contact, disparate and disproportional rates of incarceration, and as we're seeing, dangerous and fatal outcomes while interacting with law enforcement. So it's crucial that research on autism and the justice system cannot be colorblind to the experiences of autistic people of color. For instance, Black, Indigenous, and other autistic people of color are likely at increased risk of police violence, particularly if law enforcement is unaware of autism, and the implicit biases that officers may have may lead them to view these autistic behaviors as troubling. Again, little is known about the experiences or the degree to which any risk is magnified when looking at the intersection of race and disability status. And this is a key next step for research to focus on, specifically when looking at autism and the criminal justice system. So the global autism community has been pushing for more attention on the issue of criminal justice system contact, again, given a stream of news stories from around the world that are highlighting violent and at times fatal interactions between autistic individuals and the justice system. As Lindsay mentioned earlier, INSAR, which is the International Society for Autism Research, funded our team to produce an international policy brief on autism and the justice system that was anchored by the sequential intercept model. And using this model can really help to ensure that research, policy, and practice are responding to the continuum of justice system involvement rather than focusing on siloed components of the criminal justice system. And from the onset in developing this policy brief, as well as all the other activities that have gone on, we have really been guided by two fundamental principles, one of which was to emphasize and engage with autistic individuals at all stages, as well as to develop and utilize international partnerships to create a truly international policy brief that highlights emergent practices across nations. And so this has led to the establishment of the Global Autism and Criminal Justice Consortium. And this comprises an interdisciplinary team of researchers, again, across different disciplines and expertise, as well as policymakers, autistic self-advocates, family members to autistic individuals, as well as justice system professionals. It was, again, really important that we bring all voices to the table that are impacted and can be part of the solution to these issues. Again, stakeholders are based around the world and continue to meet regularly, where we highlight and share best and emerging international practices that are focused on advancing justice for autistic individuals. And this has led to really a platform and a place where we can share resources, research, models, and programs that are coming aboard that really support autistic individuals at all stages of the criminal justice system. So the image on the screen here illustrates our partners from around the world who have been so instrumental in all of our activities. As you can see, stakeholders are from countries from almost every continent in the world, which has really helped to maximize the impact of this work. This is particularly true given differences in criminal justice systems and structures, both within countries, as Amy alluded to, a lot of state variation here in the United States, but as well as countries across the globe. One statistic in particular that really exemplifies these differences is that the United States incarcerates individuals at rates that are really unrivaled across the world. And this really sort of signals and represents different priorities and sort of viewpoints on rehabilitation. Other countries sort of differ in where they are in terms of their autism advocacy efforts and movements in that area. So it's been so crucial, but also so beneficial that just having constant and consistent dialogue across stakeholders from each nation's being attuned to the variations in criminal justice system structures, as well as autism advocacy movements and efforts, has really helped to make sure that all of the work that we are doing is translatable across the globe. I believe I will be passing it over to Lindsay now.
Thank you, Dylan. Throughout this work, we've been shaping and reshaping how our next steps will come to be. We've landed on and are advancing a specific set of priorities for research as well as community outreach and partnerships. We've learned much about health inequities and differences in risk for criminal justice system interactions, but we have a long way to go in terms of autism-specific research. We need to continue to push to understand how we can advance equitable strategies using new and different research questions, methods, and collaborations. We start asking those questions by engaging autistic individuals across all points of understanding criminal justice system interactions and linking them to health outcomes. Beyond diagnoses and health conditions, how do these interactions make people feel? Where do they lead in their lives? We don't need to start this research at square one. We have partnerships and researchers have been focusing, including Amy's extensive work, on the criminal justice system for decades and have made progress in understanding potential inflection points. We should build our work to collaborate to move these advancements forward in ways that specifically account for and consider autism. We will need research that makes a difference and extend our research in ways that improve communities today. We need to make that time and effort to form partnerships with people who oversee and govern these systems, including policymakers. We will need all hands on deck, and partnering across nations has been an incredible way, as Dylan mentioned, for us to learn and keep our eyes and ears open for new ways we can shape criminal justice system policies and practices, or to prevent these interactions in the first place. We took these priorities and we've used them to revise that sequential intercept model that Amy showed you. We made a few specific changes. As you see the version that we're about to display, we built a new model that would work across nations, across those partners on the map that Dylan showed you. We wanted to make sure that international collaboration would be a feature of how this new model might work. We see the criminal justice system as cyclical rather than the straight line that Amy showed you in the original sequential intercept model. It's beneficial to see that sequence of events, the sequence of the intercepts in that original linear model. But as we think about opportunities to intervene and how there is the presence of recidivism so often among individuals who make contact with the criminal justice system, that cyclical ability allows us to think about preventing future interactions, thinking about higher risk. We also know that the criminal justice system must account for the experiences of people who are victims, in addition to perpetrators. And this is a new lens that needs more attention as we think about policy changes among individuals and to support individuals who have had these difficult experiences. We put community squarely in the middle. We see it both as the starting point, as it was in the linear sequential intercept model, and as the centered goal of where we can get people back to where they should and want to spend their time. We also assert that experiences in jails or courts are different and may require varying accommodations or considerations for autistic individuals to get what they need. For example, jails may need to offer different environmental accommodations than courts, and courts may be opportunities to introduce new programs like peer supports to prepare and present in a courtroom to a judge or a jury. Next slide, Dylan. Thank you. So this was the original SIM, as Amy mentioned, the sequential intercept model, where we see each of those components that that Amy described in ways that help us to understand how often they happen and the implications and health outcomes linked to each of these steps. And as we move to the next slide, you can see how we modified this tool. So we took that cyclical nature of the components and the opportunities at each stage, represented by these lines, back to communities and back to points where we may be able to divert people to get them to communities, back to communities sooner, to think about not only a return to community, but also, as Amy mentioned, the services that people may need in order to stay in their communities to prevent these interactions moving forward. Okay, Dylan, next slide. So how will we use this model? We see several specific opportunities. We can use it to ensure that we base autism research across all intercepts and that we don't remain siloed in specific areas. It can also be a way to think about the continuum of needed supports. Does what we do in courtrooms have an opportunity to have continuity into jails or prisons? And how can probation or parole programs carry through components of what individuals may have experienced in jails or prisons as well? How do we use research to communicate quickly to policymakers? Criminal justice systems around the world are at a critical juncture for reform. And this research is needed now, but policymakers rarely read journals, and we need new ways to get research out to people who can use it. We need evidence for programs that prevent interactions with the criminal justice system and programs that get people back to their communities, wherever they choose for that to be. And Dylan is spearheading new work to review the existing research base to understand where we have the largest gaps to fill in this research that exists, so that we can have a new set of priorities for next steps. Next slide. Thank you. Criminal justice systems are moving forward, and so our research needs to be at the table to help drive opportunities for change. There are new initiatives here in the US and abroad to structure policy that links directly to health insurance access, health service use, and health outcomes that are directly relevant and timely And we need to track these movements and ensure we're keeping pace with the policy that's moving all around us as we think about our research questions, our research partnerships, and our research methods. Okay, Dylan, next slide, thanks. So there are several places where you can check out our work, track what we're up to next, and the work of our partners. We have a website that I'll ask Dylan to pop into the chat with highlighted resources and a link to an international survey that we have live right now across all of our partnering nations. If you are an autistic individual, a caregiver, or a care partner, or a criminal justice system professional, we want to hear from you. The highlighted resources include social stories and other autism-specific resources from the Autism Services Education Resources and Training Collaborative, or the ASSERT Collaborative, based here in Pennsylvania, and we encourage you to check them out as well. Also, the Policy Impact Project on Twitter is a great place to look at our work to help translate research into policy and practice. And we've got a link here also for you to check out the INSAR policy briefs, which hit on timely and key topics. There's, I believe, 2 that are live now, and our policy brief will also be released in 2022. Slide, thank you, Dylan. Research is moving quickly on this topic. We want to highlight here some of the work from our colleagues in the UK and Australia, which has been helping to push this field ahead. We're grateful for these partnerships and encourage you to continue to check out their work as well. Next slide. And thank you for your time. We look forward to your comments and your questions.
Thank you so much, Lindsay, and thank you everybody for listening, and thank you, Dr. Wilson and Dylan, for presenting as well. It looks like we don't have any questions in the chat just yet, but I do actually have a question for you all myself. So I did notice that because you're working with a lot of international, groups and institutions. Do you know if there are similar like racial and ethnic disparities in countries with like a predominantly Black or Indigenous population? Like example, I think like some of the countries in Africa, I think probably, I didn't know if that was something that you might have experienced or observed.
Amy, would you like to comment on that? I'm happy to take that one or add to what you'd like to say too.
No, you go first.
Okay. I would say that question is complicated by the fact that there are such tremendous differences in the approach and status of criminal justice systems. So even looking at South Africa and rates as compared to the US, because the justice system in South Africa is structured so differently and at such a different stage. Sorry. It's really difficult to understand how those differences or lack of differences might parlay into need for action. And what do they mean for health outcomes in the autism community? So I think it's a great point that that's something we need to think about. It's certainly something I think Dylan and I have had about 1,000 conversations around trying to make sure that we are clear that the justice system in Sweden or South Africa or Canada is different from the US. And we have to really approach our research, approach our dissemination of our findings and our partnerships in ways that account for and consider those differences. Amy?
100% agree. And this is more personal answer than from the research. It seems like right before COVID hit, I was at a conference for an international conference for human rights for incarcerated women. And I had the opportunity to meet researchers from a number of countries. And one of the things that was remarkable to me was, well, I cannot give you like the exact statistics on the rates of involvement, the disproportionate impact of involvement, was a topic of this conference. So, for example, Indigenous women in Australia, this was something that was presented on, have really severe health outcomes in the community, and then they're exacerbated in the correctional system, and even the prisons where they're incarcerated. There's I was supposed to go to Australia right until COVID hit, and we wouldn't have even had to really be checked to get into the prisons in the part of the country where the Indigenous women were incarcerated. They're a very small proportion of the population of Australia, but a very large, I was told, proportion of the incarcerated population. And we heard similar discussions from people from Canada, Thailand. So I think there are some struggles, and then there are some particular things that are unique to the United States that we have to look head on at and address.
Thank you. I see a question in the chat. They're asking, how does your research take into account the diagnostic disparities, because Black individuals are often diagnosed with more additional diagnoses in addition to autism?
Sure. So this is a place where it's hard to identify data sources that can help us answer that question in a robust and rigorous way. We're excited that our international survey has yielded a response that I think will, for among the first times, let us look at those differences within countries and across countries as well. And so, the survey responses, we asked autistic individuals as well as caregivers about co-occurring mental health diagnoses. And I think this is also a place where we don't need to start from scratch, that there may be a way that individuals with a co-occurring mental health diagnosis may have different opportunities to loop into diversionary programs that have long been established for individuals with serious mental illness or mental health diagnoses, that individuals who present perhaps with autism as their primary or only diagnosis may not be eligible for it, depending on the definitions of those programs. And so we need to understand, and I think get better at documenting what exists where. I think some of the mapping exercises that Amy talked through, having the SIM as a model for us to even begin to understand this at each phase of criminal justice system contact, presents us with tools, but we are really just beginning much of the research that's needed to understand exactly that set of differences. And I think we know from much of the public health research that we need to go beyond describing when differences occur across racial or ethnic strata, and we need to actually begin to unpack why those differences exist and go further, both on the diagnosis front and the criminal justice system front. So we have some intersectionality happening here, whereby individuals are faced with multiple components that they are needing to navigate. Thank you for that question. Please stay tuned and check out our website as we develop more, and Amy or Dylan would really welcome your input on that question as well.
I would just second taking an intersectional approach to understanding the health of people with criminal justice system contact is critical.
Thank you. I do have another question in the Q&A section. As a researcher, how difficult has it been to work with governments to retrieve criminal justice data? That's a very good question.
Amy, you are by far the most qualified to answer that question on this call, in that you've done it.
So, such a good question, and even to answer it is a little precarious. So I would say this. I think that some systems are more open to outside outside review. And I think any system at a given time, and it's not just always one system is open and one system isn't. Systems have life cycles, right? And so I think the relationship is key. And that's been my experience in all my community work, not just my community work with the criminal justice system. I have a brief background as a parole officer, and when I was practicing, and I think that probably helps some in terms of my somewhat understanding their language, and sometimes maybe they'll have some more trust with me. So I think sometimes if you can have somebody just with knowledge about the criminal justice system on your team, that could be helpful. That's been my personal experience. And also spending some time talking to people who've been working around a system that you're thinking about working with, because it's a big investment of time to develop relationships. And yeah, and hearing like where a system is in their life cycle of openness to outside involvement. I don't know if that's helpful, but I'll stop there.
Yeah, I mean, it definitely sounds like some kind of expertise or at least experience in the criminal justice system will probably definitely help. But yeah, I can imagine that it's probably has been a challenge. Another question is, what training exists for people with autism spectrum disorder or other disabilities on interactions with law enforcement, and what are the outcomes of such training? And then kind of a separate part of that question is, what are the outcomes for training for law enforcement on interactions with ASD individuals?
Right. This is a place where in Pennsylvania, there's been a tremendous amount of work to promote and create resources and information and training on autism for criminal justice system professionals. In parallel to what Amy just described, there's a partner with the Assert Collaborative in Pennsylvania who has experience both as a parent with lived experience and as a parole or probation officer. And I'm very well connected also to individuals who help us understand the elements of the system where there's a need for resources. And that work has been ongoing for many years. It includes the social stories that are available on the Assert website, and an unbelievable amount of training in the thousands in terms of criminal justice system professionals in Pennsylvania who've been reached by autism specific information through the Assert Collaborative or the Philadelphia Autism Project. There are a couple of other assets that we've documented. So the Philadelphia Police Academy includes autism specific training, which one of our partners, who is a trainer at the Philadelphia Police Academy, has worked really hard to develop and implement. And we know that there are components of crisis intervention. So we deliver some autism specific components of crisis intervention training to first responders, which can include, for example, Philadelphia police officers who have tasers receive that training, and we deliver an autism specific component here in the city. We've sought to understand if there might be room in the mental health first aid training curriculum, which is a national, and maybe it might even be international endeavor to help individuals understand the needs of people who present with differently in communities, or where criminal justice systems interactions may be at elevated rates. And so I think that is one potential door we need to continue to sort of maybe bang on a little bit harder. I think your question about outcomes is key. What difference does this training make? Do people come into a room, hear the information, and walk out with tools that help them to handle situations differently? And I think that's incredibly hard to measure in any training environment, let alone as people who are then sort of dispersing into communities where they're handling a wide range of scenarios, especially at a time like what we've seen over the last year with, entire communities really issuing a call to action on what does our criminal justice system look like and what will it look like next. So this is a time when thinking about linking, as you're suggesting in your question, training to outcomes is so very important. And I think we welcome partnerships to be able to do that. And, thoughts on how to do that. And Amy or Dylan, please also chime in here. You've been very much a part of these conversations as well.
Thanks, Lindsay. Yeah, I think, again, I would just sort of echo that. I think sort of the next really frontier in this research has to be sort of linking to outcomes. So I would just echo everything Lindsay said, but really that's a priority and really the next chapter of this work.
And I don't think that is specific to research around criminal justice system involvement with autistic individuals. I think that is the challenge. That is a challenge that research around people, involvement of people with serious mental illness in the justice system faces too, particularly related to police interactions.
Thank you. Okay, I see another question. So do you plan to expand the international collaboration to the global South beyond Ethiopia and South Africa? And then another comment saying that looking into the criminal justice system in terms of intersectionality would definitely add depth to the analysis, which was previously as well.
Absolutely. Dylan in particular has been so successful in brokering partnerships all around the world. And once people are identified and partner with us, has also been very successful at keeping people engaged. So we do have a new partnership in Brazil and other ideas for ways that our existing partners can help us sort of, it sounds like a hop, skip, and a jump to get to some of the peripheral countries that are in the global South, but we do believe that it's possible, and we have some survey respondents across more of the global South than are the people who initially distributed the survey. So we are committed to more and more representation, and also to taking the data from our survey and giving it back to those countries so that they can do with it what helps them plan, move forward, think about opportunities. And that in and of itself has been yet another leg of work that Dylan has really been committed to and helped us to navigate. So absolutely, Maria, thank you for the comment. We are eager to take on that work. And I think it really helps us learn. It's not a place where we're looking to go in and prescribe or necessarily even know how much of our work in the US will translate, but where it helps us to be enriched by understanding the different components of how that might proceed. Thank you.
Thank you. And then, yeah, there was a follow-up that Maria said that there's a South American network of autism researchers that I think that Maria can share with you. Okay, I'm not seeing any more questions in the chat. But Dylan, I know you're typing right now, but once you get a second, do you mind sharing your screen again so I can advertise for our next webinar? Thank you. Perfect. So yes, thank you all for attending. And again, if we still have 5 minutes, so if you have any more questions, feel free to type them in the chat or in the Q&A section. Our next webinar will be on December 14th. It's going to be presented by Dr. Christy Anderson, who is a scientist also at the AJ Drexel Autism Institute. And the QR code is there to register. Let me also put the link to register in the chat. And then if you go to the next slide, if you could please fill out take some time to fill out the feedback survey, just so you can provide your thoughts on this webinar and also topics and content for future webinars. And then and then you can contact us at the email address and our social media. So we have Facebook, YouTube, Twitter, we have our listserv, and all of these This should also all be available in the slide deck that I sent earlier in the conversation. But I think that's everything. Oh, and let me also put the webinar survey in the chat as well. All right. I think we can go ahead and wrap up then. Thank you all again. Thank you, Lindsay, Dylan, and Amy for presenting on this topic. And thank you all for attending, and have a great rest of your day. And we will see you in December. Thanks, everyone.